talk about work-life balance. Well, of course, it's significant to everybody. But in Hawaii, I consider it even more significant because we're actually short 5,000 healthcare workers. So on the right here is the chart from Healthcare Association of Hawaii's assessment, and I believe this was 2 years ago. We have a shortage of 3,873 workers other than physicians. And yeah, I can't even read that with my glasses on. Anyway, almost 4,000 healthcare workers. Plus, ideally, we would have another almost 800 doctors, but I'm sure these numbers have gone up. So I want to make sure that everybody is healthy and happy working in Hawaii and can always see things that they like Dr. Weir says, mother hen and 6 chicks running around the front yard. You can see those at the medical school too. So anyway, we need to keep all the healthcare workers we have as long as we can, and we need to get new workers. I'm sharing this just because this is what I do with most of my time. I know most, but the physician workforce, we do the assessment every year. We have 12,000 MDs and DOs licensed here, but only 3,500 work, and only for 3,033 hours of full-time service. But the good news is it's an increase from last year, 71. But we need to have an increase of 100 every year to really make progress. So we have a shortage of anywhere between 500 to 800, depending on if you're counting the water in between us or not. And we lost, I'm gonna close out the chat right now so that I could see. 86 people retired last year. That's a really big number for retirement, and 173 moved away. So we're lucky we got 71 more FTEs, but we need to do better every year. This is the chart that we've made since we started doing this, and you can see how so economic recession makes us stay working longer, and COVID made folks quit, and then we're slowly building back up. These are the numbers in primary care. Blue is last year, black is this year. You can see that Kauai has been pretty constant in primary care, Maui, pretty constant. Honolulu's gotten worse, and Hawaii County's gotten worse. And you can see the shortage numbers there. And then this is the overall doctor numbers, primary care and specialty. And I don't know what else to say about this, but it hasn't changed a whole lot. We're trying to break the mold, but we'll talk about that more. And then if you're looking at shortages by percent, these are the biggest percentage shortages: peds GI, endocrine pulmonary, colorectal surgery, and thoracic surgery. And the numbers aren't that big of people, but so one peds GI could make a big difference, and 7 would be awesome. So you can see that we're not talking about a lot of people, but a few people could make a lot of difference. So anyway, what are we doing that's improving things? Well, the general excise tax exemption passed through the legislature last year, but it doesn't start until 2026. I don't know why, but that's the deal. Preceptor tax credit, you can get $5,000 off your taxes if you teach doctors, nurse practitioners, or physicians. But I think you have to be in one of those groups to get this benefit, but we're trying to expand it to all healthcare education in the state. Loan repayment, everybody in Hawaii who has a license or certificate in Hawaii and takes care of 30% public insurance folks, which is Medicare, Medicaid, TRICARE, Quest, and veterans, can get can apply for loan repayment. We funded now up to 900, but we have 2,500 applications. So we're going in for the long term. And the governor's trying to get us 15 million a year to make a dent on the 2,500 folks who need loan repayment in Hawaii. But we're also using this to recruit from the mainland, from the continent, because if they are residents, I can get them loan repayment right away, and then they make a 2-year commitment to Hawaii. There are resources for recruitment. In Hawaii, ahec.hawaii.edu. Little typo there, just ahec.hawaii.edu, where there are resources for recruitment. And there's wonderful training programs now in high schools on Oahu and Maui, and hoping to get them to the other islands so that students can become community health workers, medical assistants, at least at one high school, farm techs, lab techs, front office staff, and EMT, not EMTs, but EMDs. It's the step before EMT. They can get one of those certificates in high school now through a collaboration between Good Jobs Challenge and Healthcare Association of Hawaii and Hawaii Pacific Health. So that's exciting, and it's expanding. And then we have pre-health career corps, Good Jobs Challenge, internships, lots of stuff. And if you go to that website, ahec.hawaii.edu, you should be able to find that stuff if you're interested. So now, enough about my stuff, back to you. So on echoes in the past, we've heard about this negativity bias that humans have. So because we used to have to forage and run from predators that could eat us, and we had to be very focused on preventing our death in past centuries, we actually are more likely to notice negative things than positive things. This was good for the species as a whole, but right now, I think this is one reason why a lot of folks are depressed, because we are more aware of negativity than positivity. So if you spend a day working with patients and 5 patients say, "Oh, you've been so much help to me," and one patient says, "Oh, you're a terrible healthcare worker," what are you going to go home thinking? You're going to go home feeling bad because one person said you were no help, even though 5 people said you were great. So we're more likely to hear this, remember this, because it's used to be a threat to our survival. It's not a threat to our survival anymore. So we need to put this negativity bias away. And how do we do that? So if we're noticing more negative things, and we can acknowledge that we're feeling, hearing, remembering more negative things, we need to be mindful of that process and say, hey, that's normal. I'm human. That's normal. But I need to put that away now, and I need to remember the good things because I want to feel good about what I did today. I know 5 people said I did a great job. One person said I did a bad job. The 5 do outweigh the 1. So in our work-life balance, we want to feel satisfied with our work. We want to enjoy our colleagues. We want autonomy as part of a group. So that's coming back more and more now, coming up more, because in some work settings, you don't get any autonomy. So those are just a few things about work we'll talk about. But work-life balance, right? So sleep, relaxation, family, play. There's so much we can do in our hours of unfettered work-related life. So that's what we want to think about. How do we balance these things so that we're working the right amount, we're working in the right setting, and we're loving our life? Loving our life most of the time because we know we have the negativity bias, right? All right, so this is the Lokahi wheel. It was created by Kamehameha Schools, and it is used by UH to teach a lot of programs for student wellness. And I just like it. It just makes me feel good. I don't know, just looking at it, it makes me feel good. I am no great scholar of it, but it makes a lot of intuitive sense to me. So we have six areas of our lives that we need to balance. And they're not all equal in everybody's lives, but we've got our spiritual beliefs, our soul, what we feel is meaningful to us. We've got our friends and family, so our connections that we know research has shown are very important. So making friends and keeping friends keeps you alive longer. Married people stay alive longer. Um, I just heard a study the other day that people who have good attitudes about aging and embrace it instead of that negativity live longer. So we need connections, we need spirituality, our work or school. We often need to feel some purpose. And so we do need to embrace our work life, that part of life. And then there's our thinking mind, which has a lot of power. Um, and we don't actually talk to our mind that much, I don't think, because if we did, we would be able to say, hey, that's your negativity bias, put it away. Um, we'd be able to meditate even for seconds, which doesn't mean clear your mind out, right? It just means let the thoughts go through. Oh, that person was not happy with the way I took care of them. Oh, good luck and pray for them. Let the thoughts go through because your mind really is an amazing thing and we don't really understand it all. We understand where the pieces are, we understand where stimulation comes from or goes to, but it is really powerful in all kinds of things and we just scratch the surface. So recognize your mind and recognize what you're thinking, because you have time for thinking that we'll talk about in a little bit. And then, of course, there's your feelings and emotions, which are explosive in this wheel, just like our volcanoes, but they are. And so you need to tie into your mind so that your emotions don't take over. Because it's really easy to feel bad when one person says, oh, you stink as a doctor, or, I really wasn't happy, even when the other five people said you were great. So, we know emotions are they're good and they're bad. They just are. And so we recognize them, hopefully. And then there's our physical and body. And we need to feel good in all these things to feel balanced. And so even when we aren't doing enough exercise, we want to have a goal set for that because we want to feel that we're taking good care of our body and our physical person. And we'll come back to this in a minute because I just like it so much. um, anyway, so work-life balance. Really, there's no balance. You work like 1,800 hours out of the year. You sleep like 2,500 hours out of the year. And then you've got 4,300 hours just for living. So let's see how we can spend those 4,300 hours not worrying about one or the other of the other two things. Because no fun, right? And that's our negativity bias. So let's be positive and make the most of all our time. Okay, so a good thing to do. I know we're stressing well, we're not necessarily stressing the negative, but what are your work stresses? So if you can write them down and say, well, is it your boss? Is it you don't have enough time? Is it that there's too many sources of information coming in? Because that's very common in healthcare right now. You got emails, you got phone calls, you've got instant messages, you've got texts, you've got people in front of you asking you for things, as well as you've got your patient. So that's one area of big stress. We'll talk about pillow time. Are you doing your charting late at night when you're falling asleep? Is that taking away from your sleep and lifetime? What are your stressors? If it's a coworker, if you can identify what it is, let's see if you can emphasize the positive instead of the negative in that and maybe change things, so that you have a really good work situation. So keep that in mind. And part of that is, who is your team? Because your team, when we're talking about connections, your team is going to make it or break it, right? If you can depend on your team to help you out and you feel like they're supporting you and you have enough people on your team, we're so short of people in Hawaii now in healthcare that we don't necessarily have enough people on our team. Maybe you need a bigger team. Maybe you need a different team. Can they help you with more things? Can they take some things off your plate? There are some restrictions about what different level folks can do with different educations, but why don't we push the boundaries and see what people can do to help you? Because we all want to help. That's at least in healthcare. Everybody I know in healthcare wants to help others. And so let's see what somebody else can help you do, because I bet there are a lot of things that you haven't thought of that you could hand off. And then how do you enjoy each other? Do you have lunches together, or do you just leave, or do you shut your door and have lunch, which is good too, because you can get some meditation and some sanity back. But what do you do together as a team that can make you enjoy each other more? So um, I was talking to Queen's doctors a few years ago, and they said they took our doctor lounge away. We don't have any place to just sit and chill, and there's no food for us. We just want some hard-boiled eggs. And I went, well, I'll bring you some hard-boiled eggs. And then COVID came and I never did. But you can go to the Workforce Summit every year. That's going to be on September 6th next year, probably at the medical school again. And it'll be fun. We do fun things. It's not just all serious like this. Maybe this isn't all serious, but we try and do very fun things for people, including shave ice and prizes and things like that. What other things can you do that will make you feel more connected? And I know one of them, and I think we've had her talk on here, Dr. Wee, Walk with a Doc. Yeah, I know we've had her talk on Echo, but she goes I think it's every Saturday up at Patsy Mink Park, not Patsy Mink. What is the park up in, uh, I forget. Anyway, and she walks with about 30 people, and most of them come every week, and they know each other, and they have treats, and they usually have a talk at the beginning. It's really nice. I did it last month, and it's a really good connection. And of course, there are specialty organizations, and it's good to be in one of these, although I got mad at mine and my national association, and said, I'm not going to pay into that because they charge big bucks. But we now have community health worker organizations. We have mental health HUIs. There's one on Maui. There's one on Kauai. We have Hawaii Association of Physician Assistants, Hawaii Medical Association. There are lots of nursing organizations. And we know that because some of them were on strike or are threatening to strike, which is a form of uh, uh, well, I don't know if I could, yeah, positively showing your impact. Um, and then if you want to form a new organization, maybe we could do that. So the Maui and Kauai mental health HUIs, all I did for them was start a listserv through UH. That was easy. And I said, I'll put $2,000 aside every year, and you can buy, you can have lunches, or, at your meetings, have food or whatever you need. Oh, good. Dr. Wee says, Patsy T. Mink Central, I thought it was Patsy T. Mink, Central Oahu Regional Park, which is really nice. Every Saturday, 8 to 9 a.m., all ages and fitness levels are welcome. This is our 9th year, and it's a free family event. And they have different walking tracks. They have the short, the medium, the long, and you decide which one you go on. It was very cute. Anyway, new organizations. If you want to start a new organization for healthcare workers, I will help you. Just let me know. Away conferences. That's a nice way to find out what's going on in the continent or in the world, but going somewhere else. So all these things can help you feel connected, which, as we said, we need to do. Oh, group vacations. I don't know if you want to go away with your medical healthcare team, but some places do that. All right. Now, oftentimes doctors at least say, this work-life balance stuff, it's all about me doing yoga. Well, I'm already doing yoga. It's not working. So I will tell you flat out, it is not just about you changing. It's also about your organization changing. And that is hard. That's harder than you changing. And that's why we always harp at you to change. But it is essential that your organizations acknowledge what's going on and help people. And so we're going to talk about some ideas, and none of this is easy. I am not saying it's easy, but it is necessary. The bigger the organization, the more necessary, because people are leaving all the time because they don't feel heard, they don't have any power, they're treated like a cog in the machine. I've heard all these things. And that's not what you want to do after spending your whole life getting educated and wanting to help people. So at your organization, be a factor for change. Develop ideas, share your ideas, push for the doctor lounge back if that's what you need, or get together in a larger group and say, let's have a healthcare worker lounge. Be the squeaky wheel to get a clear governance structure, get appreciation for healthcare providers, get organizational support. And if it's for that healthcare lounge and some food in there every day, that would totally be worth it. Pass on your excellent ideas. So even if the first person doesn't listen, just keep going and talk to people, and your ideas will get refined and added to. And if you're on committees, you can voice your ideas to bigger groups of people, but don't do too many committees because then you'll burn out. If you have a chance to join leadership, I would, if it's not going to burn you out. And then see if your organization will, this is a good challenge because the American Medical Association's Joy in Medicine Health System Recognition Program provides hospitals, medical groups with certificates if they can reach a certain level in this by doing activities. So if you're part of a large organization or a small organization, look up AMA's Joy in Medicine Health System Recognition and challenge your organization to see if they can join. This is an article in a nursing journal by these folks here, and they looked at multi-professional perspectives to reduce moral distress. And what they found was you have to do short-term and long-term things, and you have to have daily practices. You actually want to prevent the moral distress as much as you want to solve it after it comes up. So the more you can try and prevent things through the care team, management, leadership, and the industry. And of course, we're getting more difficult. You've got your care team you can talk to, you've got your management, harder to talk to, and then you've got the US healthcare industry, which is, oh, crazy. So anyway, they recommended interdisciplinary decision making. So everybody having a voice, trust in the managerial relationship. And this is a big one. And this is why there's always like 360 reviews and stuff. And hopefully they're listened to. But I know at some healthcare organizations, they are just kind of thrown out, unfortunately. But I hope in time they will be listened to. And then have organizational policies and practices that explicitly invest in the mental health promotion as well as diverse leadership opportunities. So recognize the need for mental health support and have lots of people involved in leadership from different points of view. And their conclusion was that moral distress needs to have interventions that target the short-term stress every day and the long-term impacts of, and they call it moral residue. So moral distress leaves moral residue. And the health systems must put money behind their mouths, their actions, and commit to it. And hopefully it's an ethical workplace culture that explicitly values mental health and well-being. And if your institution says, we value mental health and well-being, put your money behind it and show us. And I really respect that. And so when you have ideas of how your organization can do that, hopefully they'll listen to you. All right, pillow time. Mentioned before, my husband used to have his work computer and fall asleep over it in bed every night. Now he's doing non-clinical work and much happier. But unfortunately, he is one less FTE that is seeing patients in Hawaii, which is my whole thing, right? Trying to get more. So how can you make charting easier? How much time do you spend outside your regular work hours doing this? Because usually it's hours and hours. Can you make a template for your electronic health records? Which, by the way, promised us, EHRs promised to save us time and save lives. I don't see any of that happening. But that's probably because they were designed by computer guys and not healthcare guys. So it goes computer guy to healthcare and then not healthcare to computer. So we need to take back the reins of our EHRs. And I know they're huge, they're expensive, but they are trying to develop resources. So ask people about templates for your most common visits. Is there a template? And I know sometimes when you paste it into your electronic health record, it turns it red or something. But you know what? If that's going to save you 2 hours a day, well, it's going to save you 2 hours a day. And I would make that choice. If it's going to highlight that you've copied and pasted this, well, ask the lawyers in your organization, why does it do this? Why does it point out something to potential other lawyers? This is silly, because I'm going to use this template for almost all my visits, and then I'm going to write in the specifics. Now, I recommend against just copying from your whole last note into this one, because you could have something really funky in your last note, and you would be continuing it on. Anyway, can AI help? There are AI scribes now. I'm not sure I'd want this, but there are AI scribes that will translate everything you say into your chart. I prefer human scribes myself, but you can see what is possible and you can try different things out. So human scribes wise, there are volunteers that might be able to do it. And let's see, Laura says there are a few services for that which are HIPAA compliant. Yes. Dr. Weir says, make sure you review your template with each entry before you make it permanent. Yes, I've heard some very funny things copied in charts. And Laura Davies says there's free, I think it's the AI scribe at medscape.com. So give these things a try. Ask your IT folks, say, I need some help. It's taking me too long to do my charting. Help me. Can I get a scribe? Can I get templates? Help me out here. And there's usually somebody at your organization who's really good on the computer. They're usually pretty young, but they have really good ideas. Okay, now, most likely your employer supports some kind of healthy activities. Wellness time every week, a gym membership maybe. One industry I heard of gives you $100 towards health exercise equipment. I just found out about it because it turned out in camping supplies, but it's exercise equipment every month, $100 every month. So I want you guys to go find out. Ask your company what resources they have in mental health, what resources in physical activity, what support they have for your total health, what IT support, whatever you need, find out what they have, because I bet they have something. All right. Now that you've written down what is stressful about you at work, you can write down potential solutions. We just did some research of those other 8,000 doctors who are licensed in Hawaii but live on the continent. And they said 4 things. They said a 50% tax break would be nice on Hawaii taxes, 110% of their salary. They said a 4-day work week, and they said some housing assistance. That was the most common answer, but different groups gave different answers. But that 4-day work week was not expected. If that is what people want, then we really need to work towards that. If that would get more doctors to Hawaii, oof. So what does your schedule look like? Do you like to work 2 days, have a day off, work 2 days, have a day off? Some people work, a week and then have a week off. But what would you like? Would you like to work 4 days straight, have 3 days off? So ask for it. If you need to go to half time, Some places don't let people go to halftime, but if you say it's halftime or I quit, they will often take you halftime. Because we need people so badly in almost all healthcare systems that halftime is better than nothing. Of course, halftime often turns into more than halftime with all your charting, but um, making barriers, making limits, putting limits on your employer is also possible, although it feels very strange to healthcare people. And then, our big bad US healthcare system is using this against us, right? They say, oh, you don't want to take care of all your patients. Oh, you're abandoning your patients. Oh, you are not very caring, are you? But really, you're trying to take care of yourself first, because if you don't take care of yourself, you're not going to be taking care of your patients. Um, so think about what you want and ask. Remember squeaky wheel. Ask, ask, ask. You can ask in different ways. You can ask in the same way. You can describe how it's important to you, but show how it will benefit the organization, even the economic benefit. So if you work half-time, they save on this. You don't need as much office space. They can share the office space. You can work from home. That'll save office space. That'll save time. Anyway, and talk to your friends. See how they do it. Because everybody's thinking about this. It's not foreign to anybody. We all want our best work life, and we want our work-life balance to be great. All right, give yourself permission. We feel guilty if we're not working overtime. We feel guilty if we don't go to work sick. And what have we learned about that? Don't go to work sick. Nobody wants you there. But that was our ingrained culture. Nothing would keep you home. But now we need to stay home when we're sick. We need to cut back if that's going to help us. And it's okay. It's great. You can always go back up later if you want. Give yourself permission to say no. Oh, do you want to be on this committee and that committee and this committee? Pick and choose, but pick just what you can do. And then be able to say no. It's fine to say no, even if it's to patients sometimes. If they say, I've just got one more problem, think of something that will make you comfortable saying it, like, let's discuss that next visit in 2 weeks or something like that. I know you have more to talk about, but our time is over. Practice it. What will you need to say? Because it's so hard for us to say no to anything, but we have to take care of ourselves. Oh, see, I said it'd be back. So let's see. Spiritual. We all like to help people. So whether we go to church or go to the beach and look at the moon, or whatever we do to fill our spiritual cup, make sure you do it. Friends and family, we talked about a lot. We hope our work colleagues are friends, but we want to connect with them as much as we can. Work, school, we talked about that, making the best we can. Now, thinking and mind, let's see. Here's some thinking time that I realize I used to consider a waste of time. Half-hour commute to work, half-hour commute back from work. Ooh, wasted hour, right? So now I try to turn this into something productive. And I have everybody teases me. They say it's not safe, but I have a piece of paper and I have some pens near me on the console there. And I think of things all the time when I'm driving. I have like these big ideas. And so I'm writing it down in a safe manner. I'm not texting. I'm not writing it in my phone. I'm just scribbling it. Half the time I can't even read it later. But like 2 days ago, I had this idea that, well, why don't we just pull out the stops and do everything we can for housing? Let's talk to all the banks and get a 0.25% interest rate lowered. Let's talk to investors and bring them to the table to help invest in homes for people who move to Hawaii. Let's ask for free land. Let's just do all of this. So I was writing it down. I couldn't read it all, but I'm going to try. And then think about what do you like about it? So I have some really awesome views on my way to and from work. But usually, I just kind of, ooh, there it goes. But you can really enjoy it. Um, and I like looking at other people's bumper stickers. Sometimes they're really funny. Um, and so those are things I do enjoy about the commute, but I don't do it, of course, as much as I used to, maybe 3 days a week. So think about what you don't enjoy about it. Think about what you do enjoy about it. And how can you make it better? Do you want to carpool? Could you carpool with some friends so you could have connection time at the same time as you're getting to work? Can you work from home? You can ask your boss or yourself if you're your own boss. What do you like better? So I'm trying to get us to think differently about our wasted time, kind of shift it into making it something practical and restful. And I think maybe I have these big ideas when I'm driving because I'm not busy talking or writing or anything. I'm just driving and something pops into my brain and my staff hate it because then they have to do more work. But, it's an idea for a new grant or an idea for a new program. Um, and it happens when I'm driving. I don't know. So anyway, think about what you want to make that time if you have a commute. Ah, now let's get into the good stuff. What makes you feel good? How do you relax? What makes you smile, laugh? What makes your heart smile? And so I asked you at the beginning, your dog makes you smile. They're a beautiful thing to look at. The ocean, the chickens, the trees, the animals, um, the sky. There's so many beautiful things. What makes us relax in particular? What makes you laugh? Because laughing, uh, I don't know. I don't know if they have studies of whether it makes you live longer or something, because I don't know if you can measure how much someone laughs, but it sure feels good. So sometimes I just, um, when somebody sends me an email and I just bust up laughing, I send them back an email, say, LOL, LOL, thank you so much for giving me a really big belly laugh today. That felt good. And people like it. So if someone is making you laugh, even if they didn't mean to, thank them, because it feels good. And if I think emojis must have come about to make people smile, because some of them are pretty silly, and I'm not the best with emojis, but um, think about what makes you smile. What would you like more of in your life? And thankfulness, very important. Now, there is research on thankfulness. The movie Patch Adams, ooh, that's such a good movie. Okay, thankfulness. Research shows it improves satisfaction. So when do you remember to do this? And it's easy. I'm thankful for the sun. I'm thankful for the ocean. I'm thankful for the trees. I'm thankful for this computer working because I was worried it was spazzing out. But when do you remember to do it each day? When you brush your teeth? That's when I tell people to take their birth control pills because everybody usually brushes their teeth once a day. So maybe you could be thankful for something when you brush your teeth. When you get in the car to do that commute, maybe it'll make your commute a little happier. Right before you go to sleep, you could take some deep breaths. You could try meditating, letting everything just go right through your brain and latch on to something you're thankful for. And then a lot of people journal. And journaling is a really good way to, if you have a set time every day you journal, you can start with what you're thankful for. And it just feels better that you have things in your life that you're thankful for. So anyway, so ideas for how we can feel better. Yoga. I like yoga both for physical fitness as well as deep breathing, relaxation. And I also have a yoga instructor I like. He's funny, so we connect. So it ticks off multiple parts of the cycle. Meditation, I have mentioned. I used to think I could not meditate. But guess what? I can, because you don't have to empty your brain. My brain doesn't get empty, but you could think of puffy clouds going through, or There's noise next door. Oh, look, it's just passing right through and out of my brain. And that's all you have to do. You just have to lie still, breathe deeply, and let all the thoughts just pass right through. And then there's deep breathing. Um, I don't know if deep breathing relaxes us or if relaxation makes us breathe deeper, but I know it feels good. And we had a talk a couple months ago from NAMI, and I stole a couple ideas from her, this slide and a couple more, the couple next slides. But the box breathing you've probably heard of. Breathe in for 4, hold for 4, exhale for 4, keep it out for 4. And just doing that a couple times can really calm you down. The flower breathing is like you're smelling a flower, but that's the same kind of thing. It's prolonging your in breath, and then you can breathe out. And then there's a bunch of other kinds of breathing, which she went over. They were actually pretty hilarious. There was like, I think the bear hibernating, fart breathing. No, I made that up. There probably is something like that. I don't know. Anyway, exercise. Probably not right before sleep because it can stimulate some people. Although I like to walk, and that calms me down and gets me ready for sleep. I find if I exercise first thing in the morning, I get really hungry and grouchy, but everybody's different. So exercise whenever you can, and that could be gardening, that could be sweeping, it could be walking, hiking, swimming, walking your dog. Earthing is a thing where you actually connect to the earth. So your feet, your hands, you sit on the earth, but just having your shoes off, feeling the earth is supposed to be healthy for you. I don't know, but it feels good. Music. Oh my gosh, it can make such a difference. Playing music, we heard the ukulele and the guitar, just looking at those is beautiful. But just listening to music. I have different music sets. Like if I'm really stressed, I'll listen to Enya. If I'm tired, I'll listen to like 80s rock. But most of the time I'll listen to recent Hawaiian music because it just makes me feel good. But whatever makes you feel good, use it. Hobbies, keep them up. Don't give them up, even no matter how busy you are, because they're fun. You like to do them. You're good at them. Do them. And then journaling, we talked about that. And then there are a bunch of mental health apps, and we could go back to, oh gosh, I forgot her name, but the NAMI presentation, she had a whole list of health apps, and I think I have some in this presentation too, because there are a bunch. Some are free, some aren't free, but a lot of people say they're really helpful. I haven't tried them, sorry. Okay. We have had a talk by Carolyn Sakai, and she talked about tapping thought field energy, thought field energy. And this is actually stolen from NAMI. Actually, the idea is, but here's a YouTube video on it. And what's amazing is it definitely gets you out of thinking about whatever it is you were thinking about, but you can actually imagine the tapping and it'll calm you down as well, even without tapping. But I'll show you the basic tapping. Oh, I thought field therapy, right? EFT. Oh, good. Helen's going to teach us thought field therapy too. Let Summer or Char know, Helen, anytime. We love hearing from you. Oops, sorry. Let me go back to that one. No, 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 no. So what I do is I just do above the eyebrows, below the eyes, and then the sides right around under the armpits, and then the collarbones. And I just do like 4 taps each. And that is like for my stress, but there's like individualized systems as well for anger, for fear, for smoking. Ooh, I should see if I could do it for weight control. Ooh. Anyway, very easy, free, no damage. And it works for me. Let's see, Renata says, when I got a new phone, I started receiving notifications that I had my bedtime was in 12 hours and that I need to start winding down. At first, I was annoyed and was planning to delete the notifications, but now it makes me laugh and reminds me to make preparations for winding down 12 hours ahead of time. I love it. And let me see what time it is because Helen wants to show something. Um, Let me just there's just a few more slides and then we'll go to Helen. All right, let's see. Exercise. We all know exercise is good for your mental health, your physical health, your bone health, development, motor skills, immune system, whatever kind of exercise you like, do it. Because it is good for you and it feels good, at least when you're done. But no, walking the dog, I love it. Sleep. Don't feel worried about sleep because that is counterproductive. Because when I read articles that we need to get 7 hours of sleep every night so we live longer, I was like, oh my gosh, I don't know how many I get. Oh my gosh, I was all worried about it. If you're having dreams that you can remember, or you have dreams, then you're in REM sleep and you're probably getting enough sleep. And the way to get to sleep faster and for longer is not to look at your screens or a light for like an hour before you go to sleep. Reading a book is fine. Well, it depends on, what is good for you. Don't eat right before you go to sleep. Don't have caffeine right before you go to sleep. And if you don't want to wake up a whole bunch going to the bathroom during the night, then you better drink more in the morning hours and then less right before bed. And forgive yourself if you aren't perfect. Nobody's perfect. So get the sleep you can and enjoy it. Self-care, this is definitely from NAMI. So know your triggers, make a list. What makes you happy, mad, tired, especially at work. Take care of yourself. Stay connected and get information. Treat yourself, forgive yourself, and give yourself grace. Because I bet you forgive other people a lot more than you forgive yourself. You are a helping person. You always give back, except to yourself. So make sure you give back to yourself. And when we had that speaker from NAMI, it was so cute. She showed us her stress box, her self-care box. And so I thought, what would I put in mine? It would have a dark chocolate candy bar, a novel or my Kindle, some popcorn, some over-the-ear headphones, a Sudoku puzzle. If I could put a jacuzzi in my box, I would. And of course, a picture of my family with the dog. What would you put in your self-care box? Because that's easy to do. Okay, so creativity. National Academy of Medicine says we need active imaginations full of complex visions of flourishing to sustain well-being as a convention norm or broadly embraced culture. So we need to think of flourishing systems. And so don't limit yourself. If that's what you do on your drive, think big, dream. Don't close your eyes, dream. Look for the beauty each day. So we talked about this a little bit. And then hold on to the positive to overcome our negativity bias. Remember, talk to your brain. Hey, you got one negative thing, 5 positive things. 5 positive things outweigh one negative thing. Calm down. Okay, look around, tell us something beautiful. You're in the most beautiful place in the world. So you already told me some beautiful things. But when I thought up this slide, I was in LAX and I thought, I'm sitting here in the waiting room. There must be something beautiful. Okay, this is a coffee stain on a little table, side table, but it looks like a kitty cat kind of, doesn't it? So anywhere you are, LAX, wherever, you can find something beautiful. And even more important, you can find something beautiful inside yourself. I'm not going to make everybody tell us what it is, but I know it's there and it's beautiful. And you can't forget that because that's what makes you who you are. So please look for that. These are all the things we want to do to make healthcare better. We're making slow progress, but we do have, I mentioned these already. We're going to work on prior authorization for administrative simplification, higher pay, and then housing. Like I said, I got ideas for housing. So we're working on all that, but but you work on it in your universe. And then if you want to be on any of these committees, I advertise this at the summit because we've got people working on these things, but you don't have to here. But this PowerPoint will be up on Echo, so you can look at it. And then here are some resources. Let's see. There's the Joy in Medicine roadmap. If you want to take a look, if you want to challenge your organization to get into the AMA Joy on Medicine network and actually they give an award if you reach a certain point, that would be great. And then remember, it's free, it's local, it's fun. We even pay for your travel from neighboring islands. And if you want to come in early or stay late, you can do that. So put September 6th on your calendar for next year.